Thank you. Hello everyone, am I audible and visible? Okay, so hi everybody, welcome back to this PSM weekly revision session. Okay, so today we are going to talk about screening, all right, and we're going to talk about the numericals as well. We're going to deal a bit of the numericals. So I hope all of you are following this plan, guys. So we have covered biostats, now we are on screening, and like I've said, I'll try to put out classes on Wednesday and Saturday. Okay, so today was a Wednesday, so we had to wrap up our week 1 classes. Okay. Yeah, I will send you the PDF. I'm so sorry I couldn't send it last time. I will be sending the PDF. Okay. So now as I said, the classes will be happening on Saturday and Wednesday. But yeah, I'm a little unsure about the time. So today in the morning only, I scheduled the class for 3:30. So next Saturday, again, I will tell you prior when the class will be. But next Saturday, it's going to be on epidemiology. So your week 2 topics that you're going to study is epid, and to break the to break the monotony of the conceptual topics, we will take up a program also next week, which will be national TB program. All right, गौतम नगर में ही हूँ मैं अभी तो फिलहाल इस वक्त. चलो, without much ado, let's start now, guys. Please remember, this is a conceptual topic, guys. So we will be talking about certain we will be first doing the conceptual based question. So let me first show you the question for the day. Can you all see this question, everybody? No, you won't be able to because I am there. One second. Okay, I've just shifted the image for you to be visible, everybody. No audio. Can you hear me now? I think the audio is there. All right. So now can you tell me the answer to this question? Look at this image, guys. Look at this image. And in this image, you have to tell me that what does the shaded area represent in the graph? Okay, this shaded area, what does it represent in the graph? Can you tell me what does the shaded area represent in the graph, everybody? Then I will change sides to this side. Okay, what is the shaded area? Okay, so I'm getting the answer. Somebody is writing D, false negative, false negative. Okay, so let's try to understand this small topic over here, guys, where you have to think about the cutoffs. Now, every time when we begin classes, we talk about sensitivity, specificity. Let's now today take up a conceptual topic. Okay, so now suppose I have to teach you over here how to label the paths. Okay, now suppose I have to teach you how to label the flow. Just one second. Okay, now I have to teach you how to label the markings. Okay, now suppose this is an image. Okay, this is something like this. Okay, just try to understand. Okay, suppose your cutoff is here. Can you see, everybody? The cutoff is here. Let's say this is the cutoff. Let's say this is 120/80. Now, what does the screening test tell us? Anybody who's more than 120/80 is screening test positive, and anybody who is less than 120/80 is screening test negative. Okay, so this one is a black area. Okay, this one is a purple area. Okay, this one is a blue area, and this one is a yellow area. This one is a yellow area. Okay, so now I'm asking you to label all these parts. Okay, so now imagine anyone who's getting more than 120/80 is more than 120/80 is screening test positive. Okay, so what will be on the right side? This is going to be true positive. But guys, what is sensitivity? Ability to detect all those who have the disease. Okay, so it is TP upon TP plus FN. So where is this? Like, somebody is positive, but we are pointing him out false negative. So where will this false negative be? Here. Okay, a smaller portion on the left hand side. Now, if anybody is less than 120/90, 120/80 वो क्या है? स्क्रीनिंग टेस्ट नेगेटिव. So what is this bigger area on the left side, guys? True negative. Now what is specificity? If you remember, what is specificity? Specificity is nothing but true negative upon true negative plus false positive. So what is this false positive? The false positive is going to be on the positive side, but it's going to be a smaller area. Did you understand? Everybody, did you get this in your heads? It's very simple, guys. इफ यू आर स्क्रीनिंग टेस्ट पॉजिटिव, वो किधर आएगा? राइट साइड में आएगा, तो वो ट्रू पॉजिटिव है. ट्रू पॉजिटिव के साथ क्या होता है? फॉल्स नेगेटिव. सो फॉल्स नेगेटिव ये छोटा सा पोर्शन है. ओके, नेगेटिव के साइड में बट फॉल्स, सो इट्स गोइंग टू बी अ स्मॉल पोर्शन. एंड इफ यू आर बिलो 120/80, you are what? True negative. All right, but along with true negative you have a small portion which is false positive, so it is on this side. Clear? This is the first question of the day. So what is the answer over here? This one I had asked you. Okay, I had asked you D. Okay, this one I had asked you. All right, so this one I had asked you is what? False negative. Clear? Labeling understood? Now see the next question. Can you answer this? If the cutoff point of a screening test is lowered, now I'm asking you, tell me what will happen if you lower the cutoff point. What is going to happen? So next is this question. First you labeled all the parts because I'm sure you now know the definitions of sensitivity, specificity and all of that. But now I'm asking you, if we lower the cutoff, what is going to happen? And if we increase the cutoff, what is going to happen? Okay. All right, so let's see. All right, most of you are answering A. So let us again make the diagram. Okay, let us again make this diagram. Okay, let us again make this diagram. Now, if I make this diagram, see, like this. Okay, earlier my cutoff point is here. Okay, my cutoff point is here. So this is TP. Along with this, this is FN, this is TN, and this is FP. Okay, now earlier my cutoff is here. Now what I do, I increase the cutoff. Okay, let me make it on a fresh page for all of you. One second. Let me make it on a fresh page. Okay, nicely. Because this is something that most of you sometimes make a mistake. Okay, some of you, I mean. All right, now this is my cutoff. Okay, this is cutoff 120/80. Now all those who are more, so this is TP. All right, along with TP you have FN, and all those who are below, this is TN and this is FP. Clear? इतना तो सब समझ गए, ठीक है? Now मैं क्या करूँगी? I'm going to increase the cutoff. So let me take the cutoff here. Now I have increased the cutoff. Let's say I've made the cutoff 180 100. Okay, now if I increase the cutoff, less number of people are going to fall on that range. So which side of the graph is going to increase, guys? It is going to increase this side. Are you understanding? If I increase the cutoff, less number of people are going to fall on this range. So which side of the graph is going to increase? Left hand side. So if you increase cutoff, what is going to happen? Fewer people are now going to fall into that cutoff. है ना? तो क्या बढ़ेगा? True negative बढ़ेगा. This side will increase. True negative अगर बढ़ेगा, okay, if we increase the cutoff, what is happening? If we increase the cutoff, true negative increases. ठीक है? If we increase the cutoff, ठीक है, true negative बढ़ेगा. So if true negative बढ़ेगा, automatically you can see this false positive will decrease. Okay, so if true negative increases, that means what is true negative, guys? Specificity increases. All right, sensitivity decreases. But अगर अब मैं cutoff को lower कर देती हूँ, I make the cutoff here. Okay, I make the cutoff here. Let's say I make it 100/70. Now if I make this cutoff lower, more number of people will fall in this range. So कौन सा side बढ़ेगा? The right hand side increases. Okay, so if you lower the cutoff, what happens if you lower the cutoff? The true positives increase. Okay, true positives increase. That means what increases, guys? Sensitivity increases. Is it clear, everybody? समझ में आया सबको? ऑल राइट, देखो, अगर आपने एक बार और समझाती हूँ, अगर आपने कट ऑफ को बढ़ा दिया, ठीक है, अगर आपने कट ऑफ को बढ़ा दिया गाइस, तो जब हम कट ऑफ को बढ़ा देते हैं तो क्या होता है? इफ यू इंक्रीज द कट ऑफ, देन व्हाट हैपेंस? ज्यादा लोग उससे दूर चले जाते हैं. ठीक है, ज्यादा लोग उसमें आएंगे नहीं, तो ट्रू नेगेटिव बढ़ता है। बट अगर तुमने कट ऑफ को कम कर दिया तो ज्यादा लोग उस कट ऑफ में आने लगेंगे, तो ट्रू पॉजिटिव बढ़ गया। समझ में आया? एवरीवन गॉट दिस इनटू योर हेड? सो लेट अस सी ओवर हियर, if the cutoff is lowered, that means I have lowered the cutoff, so now more people are going to fall in that range. So अगर मैं cutoff lower कर दूंगी तो ज्यादा people fall करेंगे उस range में, मतलब TP बढ़ जाएगा. What did you mark everybody? Sensitivity increased, specificity decreased. Okay, everyone? Okay, so this is one conceptual MCQ that I've been wanted to discuss. I have also put out points in favor of this question. Okay, you can go through it. If the cutoff is lowered, sensitivity increased. If the cutoff is raised, specificity increased. Okay, and what decide the cutoff? When should you keep the cutoff low? Please remember disease prevalence. Okay, if the prevalence is high, cutoff is set at a lower level. ये important है, ठीक है? कभी कभी एग्जाम में INICET में पूछ सकते हैं कि when are you going to keep a lower cutoff? तो lower cutoff आप कब रखेंगे? जब prevalence high होगा. क्लियर? चलो आज ना मैं सारे कॉन्सेप्चुअल टॉपिक्स पहले करा रही हूँ. चलो इसको बताओ. 1 second. Okay, I need to change this for all of you on this side. Yeah, now it is okay. Okay. Now tell me the answer to this question, guys. If the hemoccult test is negative for screening of colon cancer, no further test is done. Okay. If the hemoccult test is positive, the individual will have a second sample tested with the hemoccult test. If the second test for blood sample is positive, the individual will be referred for more extensive evaluation. Okay. The effect of net sensitivity and net specificity of this method on screening is, what is the answer to this, guys? Now we are first applying a test, then all those who are positive, on them we apply the second test. So what is this? This is nothing but test in series. Okay, what is happening over here? We are applying the test in series. Okay, test in series. That means first all those who are positive on hemoccult test 1, on them only we are going to apply the hemoccult test 2. So this is what? Test in series. What happens in test in series? Second test is applied. Okay, second test is applied on those who are positive on the first test. Okay, on those positive on the first test. Okay, on those positive on first test. And when will you consider a person diseased? When both the tests are positive. But what is test in parallel, guys? When I say test in parallel, yes, very good, it is sequential testing. Series is sequential testing. Good. If you say this thing, it is what? It is sequential testing. Okay, it is sequential testing. But when I say parallel means it is simultaneous testing. Simultaneous testing means we have to apply both the tests together. So here we apply both tests together. And when will be the person considered as diseased? When either of the tests are positive. So what happens to sensitivity and specificity when tests are applied in series and parallel? So please remember, if you are applying the test in series and if you are applying the test in parallel, okay, this is what? Parallel. Okay, just try to remember it like that. In series, what happens to sensitivity, and in parallel, what happens to sensitivity? So in series, what we are doing? We are applying one after the other. So we'll be able to filter out less number of people. Remember it like that. So what happens in series? Sensitivity decreases. In parallel, we are applying both the tests together. So we'll be able to filter out more number of people. So sensitivity increases. In series, if sensitivity decreases, specificity increases. In parallel, if sensitivity increases, specificity decreases. Clear, everyone? ठीक है. सो अब जैसे टीबी की बात कर लो, अच्युत, अगर टीबी की बात करते हो, सो वी हैव अ मल्टी फेज स्क्रीनिंग. ओके, पहले मैं क्या करूंगी? पहले मैंने सब में स्प्यूटम किया. जो सब में मैंने मान लो स्प्यूटम किया, जो स्प्यूटम पॉजिटिव आएंगे, ठीक है, अब मैं या तो एक साथ ही स्प्यूटम और सीबी नेट लगा दूंगी. ठीक है, दैट इज पैरेलल. या मैं पहले स्प्यूटम करूंगी, फिर जो पॉजिटिव आएंगे उनमें सीबी नेट लगाऊंगी. दैट इज व्हाट इज सीरीज. इज इट क्लियर एवरीबडी? सीरीज का एग्जाम्पल, गुड, सर्वाइकल कैंसर कैंप. पहले मैं क्वेश्चनर फिल कराऊंगी. whoever is positive in the questionnaire, I will do a VIA. whoever is positive in the VIA, I will do a this one, pap smear. Did you understand everybody? ठीक है? Okay, so that is again one conceptual MCQ. Let's go to this question. What is the answer to this? Just tell me the name of this image first. See, since you have time for June for conceptual topics, if you want, you can refer definitely to the main videos. If you have time, else you can definitely go with the RR, everybody. Okay, you can go with the RR, supplement it with the Prep Ladders Q Bank, which is there on the RR, which will help you. And every day practice 50 MCQs in 50 minutes with the timer. Phone से नहीं करना है, iPad वगैरह से practice करना है. 50 MCQs, 50 minutes. Okay, पता है क्या होता है जब आप 50 MCQs practice करोगे ना in 50 minutes, it's going to give you that confidence you need for the exams. Time management में मदद करेगा, ठीक है? And you will get that confidence that every day I have seen questions from all the subjects, because you will not do a particular subject's questions. You have to do it from custom module, ठीक है? तो तुम्हें एक sense of confidence आएगा कि हर दिन मैंने इतने questions देखे हुए हैं, and that means something. Okay. All right, now what is the answer to this? Very good. This is a ROC curve. What is this? This is a ROC curve. What is the full form of this? Receiver operator curve. Now, what does receiver operator curve tell us? Receiver operator curve tells us it helps us to decide cutoffs. Okay, it helps us to decide cutoffs. Okay. Guys, let's do one thing. Let's wrap up the questions. Then I will take up your doubts and everybody who's asking in between. Okay, let me finish up the questions. Then I will take up your doubts. Okay. So ROC curve is something which helps us do what? It is something which helps us decide the cutoff, guys. Okay. Now suppose we have two cutoffs. All right, which one should I keep? So we construct an ROC curve. Now here you have to remember on this x-axis and on this y-axis, what do we have? So on the y-axis, we have the true positives. Okay, true positives. Or you could also call it as the sensitivity. Okay, and on the x-axis, we have what? We have the false positive. Or you could also call it as 1 minus specificity. Okay, now always remember, we should select that cutoff, guys, whose false positive is less and true positives are more, because false positive is also dangerous. Now, how will you decide the cutoff? You will look at area under the curve. Okay, look at area under the curve. Look at area under the curve. Okay, for whichever curve the area under the curve is more, we are going to take that as the cutoff. So, if this is curve A and this is curve B, so under which curve is the area more? It is more under curve A. Also, you can see the value 0.9. Here it is 0.8. Okay, so more the area under the curve, better the cutoff. And more area, better the cutoff. Okay, more area under the curve, better the cutoff. Please remember this. Okay, better the cutoff. And area under the curve is given by a value which is known as Uden's index. Okay, which is known as Uden's index. This is only important for AIMS and INICET, which is sensitivity plus specificity minus 1. Okay, so here we will select A. Now, what should be the cutoffs or what should be the ROC values? So, if I zoom it over here, guys, from 0.7, it is good. Okay, up to 0.7 is what we should consider. At least the ROC cutoff, the ROC value for any cutoff should be 0.7. Am I clear, everybody? So, just look at me. If you have to decide the cutoff, you will ask the software to construct an ROC curve. In that, for NEETPG, FMGE exams, you should at least know the name of the diagram and the markings. Okay, on the x-axis, you have false positive. On the y-axis, you have true positives. Whatever will be for whichever curve the area under the curve is more, you're going to select that cutoff. And area under the curve is given by what, guys? Uden's index. And a satisfactory value is, a good value that we prefer is 0.7. Okay, another question. See, what is this figure representing? So we've done already which screening test from the figure is represented. I mean, this is ROC curve. You can let this question go. Which one are you going to prefer? The first one or the second one? So again, you will see the area under the curve is more for the first one. Okay, so the answer automatically becomes 1. This we have already studied, so I'm not asking you again. You just have to remember area under the curve kiske liye zyada hai, so that one we are going to select. And area under the curve is given by Uden's index. Okay, Uden's index. And I told you what is Uden's index? Sensitivity plus specificity. In case INICET mein aa gaya, because these PYT sessions are for all the exams, guys. It is having all the previous year topics from NEETPG, from FMGE as well as from INICET. Sensitivity plus specificity. Okay, sensitivity plus specificity minus 1. Okay, all right. Moving to the next question, everybody. So let me see if you can answer this. a little tricky question. Let's see if you can answer this. A little tricky question. A little tricky question, everybody. Okay, let's see if you can do this. What is the answer to this? We are taking the blood pressure of Ram. Okay, 4 different sphygmomanometers were used. Based on the readings, match the sphygmomanometers with their respective accuracy and precision parameters. Now, what was accuracy, guys? If you remember, accuracy was validity. Okay, the ability of a screening test to differentiate all those diseased from non-diseased. That means accuracy or validity includes true positives also and true negatives also. Okay. And what is precision? Precision is nothing but reliability. Okay, getting the same findings again and again. All right, precision is nothing but reliability. Okay, accuracy is nothing but validity. Okay, accuracy is nothing but validity. Clear? Precision is nothing but reliability, getting the same value again and again. And a test is valid when it can differentiate all those who are having the disease from all those who are not having the disease. Now see, in the first one, if you see 120/80, 120/80, 120/80. So every time I'm getting the same reading, so it is reliable. At the same time, guys, it is valid. So one ka, if you see for one, okay, if you see for one, what it is, that it is precise also and it is accurate also. Yes, can you make out? It is precise also, it is accurate also. Okay, precise also, accurate also. Now look at the next set of readings. 140, 96, 108, 62 and 96 and 82. Now every time I'm getting different readings. Okay, plus is it closer to the gold standard value? No, 140, 96, 180, 62, 96, 82, they are not closer to the gold standard value. So 2 का क्या हो गया या B का क्या हो गया? If you talk about like this, D. Okay, so if you talk about D, imprecise and inaccurate is the second one. Okay, look at the next one. I have got the values 140, 96, 140, 96, 140, 96, 140, 96. Now, every time I'm getting the same values. So, definitely they are what? Every time तुमको same values मिल रहा है. तो definitely ये reliable है, precise है. ठीक है, ये precise है. But is it accurate? No, it is not closer to the gold standard value. So this is what C में क्या हो गया? Precise and inaccurate. All right. Now look at the last one. 120, 82, 120, 80, 180, 72. Now every time I'm getting different values, so it is not reliable, it is imprecise, but it is accurate. Why? Because it is closer to the gold standard value. Are you understanding? See, first you need to remember that what was the difference between validity, accuracy, and what was the difference between, what is validity, accuracy, and what is reliability. What is validity and accuracy? Getting closer to the gold standard value. Okay, ability to differentiate diseased from non-diseased. And what is precision? Reliability. Same findings बार बार मिले. तो अगर तुम पहला ऑप्शन देखते हो 120, 80, 120, 80, 120, 80, बार बार सेम फाइंडिंग मिल रहा है तो रिलायबल है, प्लस गोल्ड स्टैंडर्ड वैल्यू के क्लोज है तो एक्यूरेट भी है, मतलब एक्यूरेट एंड प्रिसाइज. दूसरा देखो 140, 96, 182, 62, 96, 82, बार बार मुझे अलग अलग वैल्यूज मिल रहे तो रिलायबल नहीं है, नॉट प्रिसाइज, प्लस गोल्ड स्टैंडर्ड के करीब भी नहीं है, नॉट वैलिड. ठीक है. तीसरा देखो 140, 96, 140, 96, 140, 96, अब बार बार मुझे क्या मिल रहा है? सेम वैल्यूज मिल रहा है तो प्रिसाइज है, बट क्या ये गोल्ड स्टैंडर्ड के पास है? नहीं, तो ये क्या है? नॉट एक्यूरेट. बट अगर लास्ट वाला देखोगे क्लोजर टू द गोल्ड स्टैंडर्ड है, 120, 80 के पास है, बट हर बार अलग अलग वैल्यूज मिल रहा है तो वो क्या है? एक्यूरेट है but not precise. Everyone clear with this? Okay, so this is the image representation of this. Please remember, validity is the same as accuracy. Okay, validity is the same as accuracy. And if you talk about precision, okay, precision is the same as reliability. Okay, precision is the same as reliability, repeatability, reproducibility. Thumbs up दो. So देख रहे हो आज हम लोग सारे ना we are trying to do all the conceptual questions before. ठीक है. चलो, let's come to the numerical and let me see if you can do this. Let's see if you can do it. So from one MCQ only, I am going to help you come out with all the definitions. I'm also going to give you all the formulas with just this one question. Okay. So a little short of time today, guys. So we will keep the class till 4:20, 4:15. Okay. We'll do a couple of more questions for you to revise so that at least you are on the track. Okay. Oh, 1 second. Just a second. Today is what day? Today is 19th. Okay, now tell me the answer to this. Okay, let's calculate everything. What is sensitivity? What is specificity? What is PPV? And what is NPV? Okay, what is your answer, guys? So now what is sensitivity? See, am I present? Disease, yes. Am I absent? Disease not present. This is the screening test result. Positive ECG, negative ECG. Now, can you remember what was the order of ABCD? I've taught you in classes. I've taught you in PrepLab. I've taught you a couple of places where I've always made you draw from your hands. Everybody, even if you're not sitting in front of me, can you practice from your hands? How is the order of ABCD? हमेशा ABCD क्या होता है? A, B, C, D. ठीक है? It's always a Z. It's never a no. A, B, C, D नहीं है. It's never a no. So, A, B, C, D. Okay, now we'll quickly revise. What is the formula for sensitivity, guys? Ability to identify correctly all those who have the disease. So, now what is A? MI is present and ECG be positive आया. So, this is TP. Okay. Now, what is B? MI is not present but ECG positive आया. This is what? False positive. Okay. Now, what is C? MI is present but ECG came negative. So, what is this? False negative. MI is absent and ECG also came negative. So, what is this, everybody? True negative. Now, in the first row, you have all positives. In the second row, you have all negatives. Okay. Now, what is sensitivity? Ability to identify correctly all those who have the disease. So, how many people have the disease over here? A plus C. Gold standard would have found out an A plus C and screening test in A. That means TP plus FN. Out of that TP. Everywhere you will multiply with 100. So, what is specificity, everybody? What is specificity? Ability to identify correctly all those who do not have the disease. So, am I absent in how many people? TN plus FP. And screening test identified it in TN. Okay, multiply with 100. Now, what is positive predictive value? Even if you have come screening test positive, do you really have the disease? So, how many people over here have a positive ECG, guys? This one. That is A plus B. Okay. So, what is this? TP plus FP. Out of them, how many have MI, guys? TP. Alright, all positives. Into 100, of course, you will do it. And what is negative predictive value? Even though you've come screening test negative, how many have come screening test negative? D plus C, which is TN plus FN. How many? कितनों में really disease नहीं है? That is TN. So now you can calculate this and you can tell me is sensitivity less than. You have to calculate basically everything. Okay, so what did sensitivity come for you? You can do it. It will be 300 upon 325 into 100. Okay, what is specificity going to be? So, sensitivity will be 300 upon 375 into 100. Specificity is going to be 75 upon 175 into 100. And PPV, you can have obviously do it. 300 upon 400 into 100. And what is NPV? NPV is going to be 75 upon 100 into 100. Okay, this is only meant for your practice, guys. Okay, this is only meant for your practice. So, if you calculate it, it was only for your revision. Okay, if you calculate it, what is your answer going to come? Okay, so your answer is, like I have done it already. So, PPV, yes, is the same as PPV is going to be the same as what is going to be your answer. You will just calculate it. All right. So you see over here 103, 4. So this is also 70%, 70% and this one's also the same. Okay, so what is your correct answer here? PPV is same as NPV. Clear? So you just have to revise the formulas, guys. What is sensitivity? What is specificity? I've written for you in this slide as well. What is PPV? What is NPV? What is positive likelihood ka ratio? Negative likelihood ka ratio? Okay, these are two additional formulas that I want you to know. Clear? Okay. Now something else I want to ask you. Can you tell me the answer to this? When the number of educated females is expressed as a percentage of total females present in the village, it is known as anybody. Yeah, 75. So both are coming the same. Did we calculate it? Okay. What is the answer to this, everybody? It is not at all difficult, just a conceptual question. So, out of the total females, how many are educated? So, what am I trying to find out? I'm trying to find out the proportion. All right. Rate ratio, numerator part of denominator, multiply is 1000. Ratio, numerator is not a part of denominator. Frequency is incidence prevalence. Cumulative frequency is constant increase. Okay, this is represented by a ogive. Okay, going to the next MCQ, everybody. Let's see if you can do this one quickly. Now, these should be on your tip. What is lead time? Lead time refers to the time between. What is your answer over here? Yeah, I'm waiting for your answer. What is the answer over here? Lead time refers to the time between disease onset and no, not B, not A. First possible point of diagnosis and usual time of diagnosis. Very good. So I'll show you the image also for this so that we can do it together. What is the answer to this? What is the critical point of diagnosis in this image? What is the critical point of diagnosis? What is the critical point of diagnosis in this image? So what it is, B is the first point of diagnosis. Okay, B is the first point of diagnosis. Okay, first point of diagnosis means does a person have signs and symptoms? No signs and symptoms. Okay, no signs and symptoms. Okay, what is X? X is the critical point of diagnosis. Okay, critical point of diagnosis. Okay, and what is Y? Y is the guys usual time of diagnosis. Okay, Y is the usual time of diagnosis. What do you mean by usual time of diagnosis? The person has signs and symptoms. So ideally, when would I have applied my test? I would apply it at point Y when signs and symptoms are present. Now, instead of applying at point Y, I am applying the screening test at point B when there are no signs and symptoms. So I'm early in the detection of the disease by what time interval? B to Y. So B to Y is the lead time. ओके नाउ आइडियल टाइम जब तुमको स्क्रीनिंग टेस्ट लगा देना था दैट इज पॉइंट बी ओके दिस इज द आइडियल टाइम टू अप्लाई अ स्क्रीनिंग टेस्ट बट मेनी टाइम्स ये आइडियल टाइम मिस हो जाता है सो कहाँ पे स्क्रीनिंग टेस्ट कम से कम लग जाना चाहिए दैट इज एक्स एक्स इज द क्रिटिकल टाइम दिस इज द ऑप्टिमम टाइम okay when you should actually apply a screening test the best time is at point B but many times it's missed so what is the optimum time मतलब कहाँ तक तुम्हें लगा देना चाहिए screening test so that you can gain an advantage due to a screening test that is point X so what is the critical time of diagnosis over here point X and the time period between B to X everybody is screening time okay please don't make a mistake over here what is ideal time and what is screening time यू मस्ट नो व्हाट इज द ऑप्टिमम टाइम ये बहुत इंपॉर्टेंट है ठीक है स्क्रीनिंग टेस्ट लग कहाँ जाना चाहिए पॉइंट बी में जब साइंस एंड सिम्टम्स नहीं है बट बहुत बार वो पॉइंट मिस हो जाता है तब तुमको कहाँ लगाना चाहिए तब कम से कम पॉइंट एक्स तक लगा दो उसको बोलते हैं क्रिटिकल टाइम ऑप्टिमम टाइम तभी तुम्हें एडवांटेज मिल पाएगा एक स्क्रीनिंग टेस्ट का क्लियर एवरीबडी क्योंकि व्हाट इज द पर्पस ऑफ स्क्रीनिंग टेस्ट टू प्रोलॉन्ग द लाइफ ऑफ अ पर्सन टू मेक एन अर्ली डिटेक्शन एंड प्रोलॉन्ग द लाइफ ऑफ अ पर्सन क्लियर एवरीवन Okay, chalo, let's go to another question, a conceptual question. Tell me the answer to this. Two doctors were asked to read and report the X-ray kappa value obtained as 0.7 months. What is the correct interpretation based on the value? So this was an INICET question. I didn't want to leave kappa statistics also. इसका आंसर क्या है? Kappa statistics आपने रट लिया? Have you rectified this? Let's see it. Okay, guys. There is a very good catch over here, guys. Whatever thing you have to do, no, like ROC curve, good value 0.7 चल जाएगा. ठीक है. कप्पा स्टैटिस्टिक्स एक्सेप्टेबल वैल्यू 0.7 एंड अबव ऑफ कोर्स, मतलब 0.7 होना चाहिए. सो सेम थिंग हियर पे 0.7 इज गुड. नाउ व्हाट डज कप्पा स्टैटिस्टिक्स टेल्स यू? इट टेल्स यू, इट चेक्स फॉर द लेवल ऑफ अग्रीमेंट बिटवीन टू ऑब्जर्वर्स. ओके, कप्पा वैल्यू चेक्स फॉर द level of agreement between two observers. Let me take you straight away to the explanation. Okay, what is kappa statistics telling us over here? So it checks for what? It checks for the level of agreement between two observers. Okay, level of agreement between two observers. And how do you calculate it? Sometimes in your because INICET is round the corner, it can give you agreement observed minus agreement expected by chance divided by 1 minus agreement expected by chance. And good is 0.6 to 0.8. Okay, so मतलब 0.7 तक we definitely work with a good kappa statistics. Is it clear everybody? Kappa statistics मतलब देखो, जैसे मान लो somebody is anemic. Okay, I look at the conjunctiva and say you are anemic. Okay, you also look at the conjunctiva and say listen, you are anemic. It may be because by chance we both are saying the same thing, but whenever the level of agreement is beyond chance, that is where kappa statistics comes into play. Is it clear everybody? Did you understand kappa statistics, guys, and the value of 0.7? Okay. Okay. Now quickly tell me a couple of more answers. Diagnostic power of the test is reflected by. Now what is diagnostic power? Diagnostic power to correctly include the disease and diagnostic power to correctly exclude the disease. What is this? Now we've done the conceptual portions. ठीक है, कट ऑफ बढ़ना घटना कर लिया, ROC कर लिया. ठीक है, we have done kappa statistics, we have done test in series parallel, we have done the calculations, we have revised it. Now just a quick look at, in another 5-10 minutes, a quick look at some of the MCQs. Diagnostic power is always predictive value. Nobody is going to say sensitivity specificity. Diagnostic power to correctly include the disease is positive predictive value and correctly exclude the disease is negative predictive value. मतलब मान लो if I am screening test positive, do I really have the disease? Is positive predictive value. If I am screening test negative, do I really not have the disease? Is negative predictive value. And which is the most useful property of a screening test? Most useful property, सबसे useful property of a screening test, everybody, is sensitivity. Clear? Okay, let's go to some couple of questions more quickly. You just have to keep giving me the answers. Okay, let's see if you can do this. A doctor uses a highly sensitive test on a patient and the result is positive. Highly sensitive, should be able to filter out more. What does that mean? If it is a rare disease, this can be considered positive. Highly unlikely that patient has the disease. If the prevalence is high, then the patient has the disease. What is your answer? देखो guys, highly sensitive means it will be able to filter out more people. Okay, now suppose if you do this test on suppose it's for RBS, let's say, if you do it on elderlies, you'll be able to filter out more. So if it is a rare disease, it can be considered positive? No. If it is a common disease, if the prevalence is more, okay, if the prevalence is high, then the patient has the disease because it's highly sensitive. And if more number of people are supposed to have it, if the burden of the disease is high, since this test is highly sensitive, then if you're coming sensitive, like if you're coming screening test positive, there are more chance of you to have the disease. अगर rare disease होता, prevalence कम होता, तो positive नहीं consider कर पाते, ठीक है? Highly unlikely that the patient has the disease. No, अगर prevalence is more and the screening test is highly sensitive, that means if your screening test is coming positive, there are more chances that you actually have the disease. Clear everybody? Okay, a simple fact. ऐसे याद रखो. हिंदी में भी बताती हूँ, कभी भी अगर कोई डिजीज का प्रेवलेंस ज्यादा है, ठीक है, तो जब उसमें एक स्क्रीनिंग टेस्ट लग रही है जिसकी सेंसिटिविटी ज्यादा है, तो वो ज्यादा लोगों को फिल्टर आउट कर पाएगा. और मान लो मैं स्क्रीनिंग टेस्ट पॉजिटिव आती हूँ, तो ज्यादा चांस है कि हाँ वाकई में मेरे में ज्यादा डिजीज है, क्योंकि वो स्क्रीनिंग टेस्ट कहाँ लगाई गई है? उस पॉपुलेशन पे लगाई गई है जहाँ पे बर्डन या प्रेवलेंस डिजीज का ज्यादा था. समझ में आया? एवरीबडी गिव मी अ थम्स अप. ओके, मजा आ रहा है? You enjoying? Like today we're doing some type of couple of different type of questions. Okay, give me the quick answer to this. 10 seconds and I want the answer on the comment section. Ability of a screening test to identify correctly all those who have the disease. इसका आंसर क्या है? सिंपल डेफिनेशन बहुत बार आया हुआ है. ठीक है, सो इसका आंसर क्या है? Ability to identify correctly all those who have the disease, guys. कितने लोगों को डिजीज है? Ability to, why are you writing D, everybody? Couple of you wrote D. What is the answer to this? Ability to identify, oh, do not have the disease. Do not have the disease. So what is the answer? It is specificity. Why is somebody writing D? क्यों लिखा है? Negative predictive value. Negative predictive value होता है, if I am a screening test negative, do I really not have the disease? That is negative predictive value. If I am screening test positive, do I really have the disease? Is positive predictive value. समझ गए? चलो. If a patient tests negative for a disease, which of the following represents the probability of her actually not having the disease? Now, in another way, I have put it out. If a patient tests negative for a disease, okay? If a patient tests negative for a disease, okay? Quickly tell me, if a patient tests negative for a disease, what of the following represents the probability of her actually not having the disease? मेरा स्क्रीनिंग टेस्ट नेगेटिव आया, क्या वाकई में मुझ में डिजीज नहीं है? तो ये क्या है? ये क्या है? वेरी गुड, इट्स रिटन probability. Probability means either PPV or NPV. So probability of not having the disease means what? Negative predictive value. समझ में आया? Whenever you see the word probability, it's not sensitivity, specificity. It is, even though I've been tested screening test positive, what are the chances or probability of me having the disease? Positive predictive value. Even if I've been tested negative, what are the chances of me not having the disease? Is what? Negative predictive value. ठीक है? So pay attention to these set of questions, very important. Give me the answer to this. Which of the following is sensitivity? Yes, probability to correctly rule out the disease or exclude the disease is negative predictive value. Probability to correctly include the disease is positive predictive value. चलो इसका आंसर क्या है? अब इसमें ज्यादा टाइम नहीं लगाना है. Sensitivity is TP upon TP plus FN. Okay, what is specificity? This one's your specificity. Then all positives, this is PPV, and all negatives NPV. Clear? Okay, now see. Number of false positive, okay, number of false positive in a screening test will be high because of, what is your answer here? Number of false positive will be high because of, number of false positive in a screening test. अब मैं बोल रही हूँ false positive high होंगे एक screening test में. क्यों? इसका एक सिंपल सा फंडा है गाइस, जस्ट वांटेड टू डिस्कस दैट फंडा टुडे. नंबर ऑफ फॉल्स पॉजिटिव हाई है. कब फॉल्स पॉजिटिव हाई होने का चांस है? What is your answer? Low sensitivity. Tawfiq is writing. Anybody else? High specificity. High prevalence. Varun लिख रहा है A. A क्या है? High specificity. Now see, when I say more the false positive, अब देखो स्पेसिफिसिटी का एक फॉर्मूला होता है. व्हाट इज इट? ट्रू नेगेटिव अपॉन ट्रू नेगेटिव प्लस फॉल्स पॉजिटिव. नाउ इफ फॉल्स पॉजिटिव आर number of, if false positive are high, that means what is lower? The true negatives are lower. Okay, the true negatives are lower. All right, specificity is lower, so automatically sensitivity is more. Are you understanding? I'll just give you a simple logic over here. ठीक है, देखो, it is very very easy. The false positive will be high in case of, ठीक है, false positive कब high होता है? सिर्फ आपको ये चीज याद रखनी है, ठीक है. Low specificity, अभी मैंने क्या बोला? False positive are high, that means true negatives are lower. So true negatives are lower, that means low specificity. When will I get false positive? More. When obviously there are low prevalence. When if suppose there is a high prevalence. जैसे मान लो कोई RBS लगाया मैंने on everybody beyond 30 years and I applied RBS on people who are beyond 65 years. Where is the prevalence more? Here. Okay, burden is more here, prevalence more here. Here there is low prevalence. Just look at this, try to understand. So now when I apply RBS among more than 65%, if my screening test is positive, agar mein positive aata hai koi 80-year-old, then because the prevalence is high, there are more chances that he has the disease. Yes, but if this is low prevalence, okay. Now, if you get a screening test positive also, now because यहाँ पे prevalence is less in more than 30 years, the chance of RBS is less. क्योंकि तुम सब में screening test लगा रहे हो, so the prevalence is less. Alright, so even if you come, अगर तुम screening test positive भी आते हो, तो कम chance है that you really have the disease. Are you understanding? So there is more chance of being false positive. But if you apply it on high prevalence, there is more chance of being true positive. Did you understand, everybody? Look at me once. Very simple. देखो, कभी भी एक screening test आप लगाते हो in a community which has a high prevalence, okay? And like over here, you do RBS among elderly beyond 65 years. So the prevalence is more. That means if you do a screening test, there are more chance that you really have the disease because the prevalence is more. But on the other hand, if you apply a screening test on a community जहाँ पे prevalence low है, so even if the screening test positive आता है, कम chance होता है that you really have the disease. Okay, there is chance of being false positive. Clear? Just look at it this way. High prevalence, high chance of actually having the disease. Low prevalence, less chance of actually having the disease. So you'll get more false positives. Just remember this. When is the false positive high, everybody? It is high in cases of a false positive is more, true negative is less, low specificity, low prevalence, and of course, high sensitivity. Clear? If specificity is low, then of course high sensitivity. So what is the correct answer to this? More. Like false positive होने का chance ज़्यादा कब होता है? जब prevalence कम होता है. ठीक है? That is the thing. Clear? Okay, chalo. Let's do a couple of more questions, guys. One thing that I wanted you to revise is last question for the day. Which of the following are true for screening tests? The difference between screening and diagnostic tests. Let's do it quickly. What is your answer over here? The difference between screening and I'll be doing 2 more questions, okay? 3 more questions. Difference between a screening and a diagnostic test. What is your answer? Screening test applied to groups? True. Screening test is done on healthy individuals? No, it is done on apparently healthy, okay, who appear to be healthy. Is it time consuming? It cannot be time consuming because you applied it on groups. Based on one criterion cutoff? Yes. If I scale more than 120/80 screening test positive, it is always positive. Does not form the basis of treatment. Which of the following? This is also absolutely correct. So what did you give me the answer? You didn't give me the answer to this. What is your answer over here, guys? 1, 4 and 5. Okay, what is your answer? 1, 4 and 5. Am I clear? Let's have a look at this chart, guys. Difference between screening and diagnostic test. So screening test is applied on apparently healthy. This is applied on those who are sick. Screening test is applied to groups. This is applied on single patients. Screening test and is always based on one criterion cutoff. And diagnosis is test results are always final. Suppose I get 120, I am more than 120/80. Then that is screening test positive. ठीक है, बट डायग्नोस्टिक टेस्ट में क्या होता है? डोंट गेट कंफ्यूज्ड बाय दिस वर्ड फाइनल. फाइनल इज मेंट फॉर द टेस्ट रिजल्ट्स. डायग्नोस्टिक टेस्ट में क्या होता है? इवन इफ एमआरआई इज पॉइंटिंग टू कैंसर, द डॉक्टर विल लुक एट द साइंस एंड सिम्टम्स. लेस एक्यूरेट, लेस एक्सपेंसिव, नॉट अ बेसिस ऑफ ट्रीटमेंट. Diagnostic test is more accurate, more expensive, as well as it is a basis for treatment. And who comes out with the who tells us about that? Let's do a screening test. It has to be applied on groups, everybody. So who brings out this initiative of doing a screening test? It's the government organizations or the non-governmental organizations. Am I clear, everybody? Did you understand this? ठीक है, चलो. So this again is an important question, the difference between a screening as well as diagnostic test. Okay. All right. One more question that I wanted to discuss over here is this one. Prescriptive, prospective. Tell me, HIV screening during antenatal visits is an example of what is the answer over here? HIV screening during antenatal visits. High risk, prospective screening, prescriptive screening, periodic health examination. Please don't say it is a high risk screening. No. Okay. Very good. Now, if you screen women who are pregnant for HIV, why? So that HIV doesn't go to the baby. So to prevent mother to child transmission, to prevent MTCT to the baby. All right. So it is for the benefit of the baby because mother is a risk factor. So it is which type of screening, everybody? It is a prospective screening. This is done for others' benefit. When you do a screening for one's own benefit, like screen for neonatal hypothyroidism, that's prescriptive screening. Pap smear lena, that's prescriptive screening. Prospective screening is done for others' benefit. And this is which level of prevention? For the first time screening is primary level. Otherwise, if you talk about prescriptive screening, it is always secondary level. It is to make an early diagnosis. Okay, I've always told you screening is secondary level of prevention, but this is an exception over here. Okay, prescriptive is secondary level, but prospective is done for the benefit of others. So it is what? Primary level of prevention. Clear? Okay. Yeah. COVID के लिए जब airports पे or you test anybody at the airports because travelers, because they are a risk factor for the country जहाँ वो आ रहे हैं. ठीक है? चलो. One last question for the day, guys. You've done a numerical also, you've done all the different graphs also, you've done the conceptual topics also, increased sensitivity, increased cutoff, decreased cutoff, ROC curve देख लिया, kappa statistics देख लिया, ठीक है, series and parallel देख दिया, definitions देख लिया, lead time देख लिया. One is left. What is this? Kaplan-Meier method is used for estimating what? Incidence, frequency, prevalence, survival. What is the answer to this? Kaplan-Meier is used for estimating. Very good. Survival analysis. Okay. After applying a screening test, how many years a person is going to survive? Okay. And if he had not applied, like over here, blue color line, surviving till 35 years. Here, surviving if he didn't apply, only till 20 years. Clear? So that's it for today, guys. I hope you enjoyed the session. We've covered almost all the topics. Like we have seen MCQs and done the questions. Okay, हमने definitions कर लिया, formula कर लिया, numerical कर लिया, conceptual topics देख लिए, images cover कर लिया. That's how you have to revise a topic. Okay, so our week 1 is over, guys. Biostat screening tests are done. Now week 2 starts. So from tomorrow onwards, you can study Thursday, Friday. क्या पढ़ोगे? Thursday, Friday, EPID revise karna whenever you have time. Saturday will be the class on EPID. Post that, Sunday, Monday, you will focus on NHP. Which program I am only asking you to focus is TB. Okay, so again, I'll meet you on Saturday. The time I shall let you know on Telegram group. Meanwhile, keep attending the quiz at 8 p.m. on Telegram group. Okay, टेंशन नहीं लेना, थोड़ा सा टाइम का ऊपर नीचे रह सकता है गाइस बिकॉज ऑफ अ कपल ऑफ थिंग्स, कांट स्टिक टू द सेम टाइम एवरी डे, बट आई विल डेफिनेटली कीप द सेशन ऑन वेंसडे एंड सैटरडे इवन इफ इट्स ऑन अ लेट नाइट सो दैट यू like we get to meet each other live and continue with the sessions. Okay, all right. No, Dr. MB, RR is fair enough, okay, for your June this thing, but you have to supplement it along with the PYQs and you have to supplement it if you have time from PrepLadder's Q Bank of RR. RR ka Q Bank देख लो, ठीक है? And also any topic that you find difficult, of course, we would say conceptual video, the main videos are definitely sets a base. So whichever topic like biostat हो गया, screening हो गया, you can refer to the main video, okay? All right, because health camps, Neha, could be for one disease particularly, and whenever we have something for one disease, it is multi-phase. Multi-purpose may we are doing for more diseases. So if it mentions that it's a health camp for, if it's saying it's a health camp for cancer and CVD, then you still can say. But ideally, health camps are for, like, let's say if you're doing a health camp for cervical cancer, it's only for one disease. ठीक है? Okay, very good, Tawfiq. I'm so glad I have been seeing you always in the classes. I remember you also. Very good, guys. Okay. Prep is new video. Yeah, definitely we're coming up with version X, guys, which will also be available to all of you in Hindi. Okay, English and Hindi both. So that's an added benefit. Plus, you're going to have the audio cue banks also. So very soon it'll be out. So definitely you can do them. Okay. All right. Thank you so much everybody. I'll see you tomorrow. Not tomorrow, sorry. Saturday को मिलते हैं ठीक है मीनवाइल क्विज करते रहो एंड गॉड ब्लेस यू ऑल पढ़ते रहो डोंट गिव अप it's just a matter of time, it's just a phase of your life, so enjoy the process. Write a story to tell, okay, to your children as well. You need to give them a story about something about your life. All right, so enjoy this process. It's not just that this is only your life, it's just that we're asking you to do perform in a certain way for a couple of months. ठीक है, so अपना बेस्ट देना है, बाकी रिजल्ट तो किसी के हाथ में नहीं होता गाइज, बट हाँ प्रोसेस तुम्हारे हाथ में है, तो करते रहो. जस्ट डोंट वेस्ट योर टाइम, बी कंसिस्टेंट. ओके, बाय बाय, थैंक यू सो मच, गॉड ब्लेस यू ऑल.